Thank you so much for having us here to discuss our research project. We have nothing to disclose. So currently, the most commonly used method in surgical technical skill training is the master-apprentice based model. Fortunately, this model can be heavily didactic and rarely extends beyond the room of the operating room. Video-based coaching, or VBC for short, is a concept that was first developed in the sporting world and may be able to address some of these deficiencies of the master-apprentice model. In surgery, it can be defined as the review of and feedback pertaining to audio-visual footage of a specific surgical operation, task, or simulation prior to and or following the completion of the same task. And recently, there has been a number of studies evaluating its use in surgery. Therefore, we aim to systematically review and meta-analyze these data into previously published data, and evaluate the impact of VBC, comparing its use in surgical residence in terms of objective surgical technical skill. This was a systematic review and meta-analysis according to PRISMA guidelines. The inclusion criteria included randomized controlled trials that evaluated the use of VBC in surgical residence alone. Studies evaluating both medical students and staff surgeons were excluded. The primary outcome was change in objective measure of technical skill, and a pairwise meta-analysis with inverse variance random effects was performed. We reviewed 2,734 articles and ultimately included 11 randomized controlled trials. In total, 157 residents were included in the VBC group and 141 were in the non-VBC group. Residents tended to be junior residents as well as most commonly general surgery residents. 3 of the included RCTs evaluated VBC in the live operating room setting, and 9 of them included post-operative or evaluated post-operative VBC, meaning performance of the task, video-based coaching, followed by reperformance of the task, and then evaluation. In terms of our outcomes, pairwise meta-analysis of post-coaching scores alone demonstrated that there was no significant difference between the 2 groups, whereas when evaluating changes in scores from pre to post-intervention, there was a significant improvement in VBC group compared to the non-VBC group. And according to the Cochrane Risk of Bias Tool 2.0, 5 studies were at low risk of bias and 3 were at high risk of bias. So ultimately, VBC appears that it can effectively improve objective surgical skill in surgical residents, and these findings may be more applicable to junior residents or those with a lower level of baseline technical skill. Limitations of our review include power, heterogeneity, as well as the fact that the majority of the studies evaluated a simulated setting as opposed to the live operating room setting. In terms of future directions, we believe that evaluating live OR footage as opposed to the simulated setting is a good first step. We also believe that evaluating feasibility of integration of VBC into surgical residency programs is something that would be important moving forward. And lastly, relying on some more novel intraoperative technologies to further use and exploit VBC is something that we can hopefully work on moving forward as well. Thanks.